Dr. Anamika Joshi. I'm an eye surgeon and a super specialized oculoplasty surgeon. So today we'll be talking about watering in a child. So what are the causes of watering and how do we treat them? That is what you're going to know after this video. So in a child there could be several reasons of watering. Some could be just temporary, that is for a few days, and some could even last longer and sometimes permanently. So the temporary causes of watering in a child could be an infection, redness of the eye that happens along with that child has watering, which can be easily cured when you give them antibiotic eye drops. Secondly, sometimes eye pressure could be raised, which can lead to watering. Thirdly, a child can have some allergy-like symptoms, and even the nose, there'll be sneezing and there'll be such episodes. In that, you can observe some watering. These are all temporary and they go easily with the treatment. But the problem lies when the watering starts from birth and it persists for months and months, and that eye of the child, either one eye or both the eyes, can have this issue of continuous persistent watering. So what is the cause of this watering in children? So you need to understand what is normal. Normally, our tears that are formed from the eye, they drain into the nose. In case if this pathway, the tear pathway of drainage, is not formed properly, like from birth, if there is a defect in the pathway, then you can have blockage of the tear duct and continuous watering from the eye. So normally the tears which are supposed to go into nose, if there is a blockage, instead of going inside, they are coming outside from the eye. So that is one of the common reasons why we see watering in a child, and it is very important to treat it timely so that we get the best results. Now, if the child is less than 1 or 1.5 years of age, a simple massaging technique can itself solve the problem. So how do we do this massaging for this kind of issues? So you need to understand that here we have our tear sac. Okay, so here you feel the bone and here is the eye. Now between this bone and the eye, there is one small, depression there which you will feel. So if you press onto this depression, then you create a kind of pressure on the tear sac, and with that pressure, the blockage automatically can open. Now the sad part is that often when I see parents, they are doing a wrong massaging technique where they are just pressing over the bone like this. This is of no use and this will not solve the issue. You need to press at the correct position, and you should do this 10 times at a time, 4 times in a day. That means 10, 10, 10, 10, at least 40 times in a day. If you do this every day, there is a good chance that only with this massage, your child's problem of the blocked tear pathway can get solved. Now, sometimes even if you have done massage correctly, the problem may not solve in some children, and also many parents, because they are doing the wrong technique, or if they haven't met an oculoplasty surgeon who tells them the correct technique, this massage may not work. Now, a child when they cross 1 year or 1.5 years of age, this massage unfortunately doesn't work after this age. So then we need to open this tear duct by passing a probe from the eye into the nose. When you pass that probe, there is a good chance that we can open that blockage. Now in a child, any procedure that has to be done under general anesthesia. So even this procedure we do under general anesthesia, but it's a very short GA. That means it just takes 15 to 20 minutes where we pass this probe through the eye into the nose, and it is very important, very, very important to do this under endoscopic guidance. Meaning when we are passing the probe from the eye into the nose, we also put one endoscope, a machine that sees that, okay, is the probe coming from the right position? Is it coming at the right location? How big is the opening? All this is very important. If you don't use an endoscope and try to do this procedure, you don't know where your probe is going and you may create some false passages. So it is very important that you get this procedure done for your child where you have the endoscope. Some eye hospitals, or I would say many eye hospitals, in which a general eye surgeon is doing this procedure, Unfortunately, they do it blinded without an endoscope, and that reduces the success rates. If you do it with the endoscope, the success rates are around 80 to 90%. In our hospital, for all children, we do it only and only under endoscopic guidance. So now, if this procedure is done timely, if you have brought the children to us in the correct age, the success rates, as I explained, are 80 to 90%. But as the child grows, that means if the child is 3 years, 4 years, 5 years of age, as they keep growing old, the success rate keeps reducing. So if you've not got the child at the correct age and that important golden time is lost, then this procedure may not work and the procedure may fail. After that, the only solution that we have for such children is a surgery called as DCR surgery. In this surgery, we create an alternative pathway. That means a bypass route, a new pathway for the tears to drain. We are not opening the already blocked one, but we are creating a new pathway. So this surgery is the last resort when all these massage and the syringing probing procedure fails. So it is very important as a parent that you bring the child at the correct age to us, to an oculoplasty surgeon who will explain you firstly the correct technique of massage, secondly, if that fails, the correct procedure, and they do it in the timely and a good way under endoscopic guidance. The procedure's name, as I said, is syringing and probing. If that fails, then you have to go for DCR. Sometimes even if you do everything correctly, we still may have failures, but that is very less, just 5% of cases. 95% of times we achieve great results if parents come on time.